Hello, everyone, and thank you for tuning in for our first webinar with the National Optometric Foundation for 2023. I hope that you guys are having a great start to this new year, and I'm looking forward to bringing more webinars to you to educate our community on different topics as it relates to your eye health, as well as other health-related issues. So tonight, you're in for a treat. We got a great guest speaker joining us tonight, Dr. Cynthia Hurd, and I'll introduce her later. Just wanted you guys to know that we want you to share this with your family and friends. We want you to connect with us as well. Be a part of the National Optometric Foundation community because our goal is to preserve vision there. And we want to also protect the vision. So we're going to continue to do these educational webinars for you here in 2023, every third Monday of the month with a different guest speaker sharing knowledge with you all there. I'm very thankful for our guest speakers. And if you're listening to this webinar and you would like to be one of our guest speakers on a topic, please reach out to us. We would love to have you on the show. Today is also a great day of service, recognizing and remembering Dr. Martin Luther King Jr., and we want to give thanks to all of the great service that he has given to us, and we dearly appreciate that. And we just want to share a quote from Dr. King here, letting you know that everybody can be great because anybody can serve. You don't have to have a college degree to serve. You don't have to make your subject and verb agree to serve. You only need a heart full of grace, a soul generated by love. So let us lead and continue to lead with love, and let us do this together as a human race there. So let's get on into the show. You guys grab your favorite drink, grab some popcorn if you desire, because the National Optometric Foundation would like to present to you during Glaucoma Awareness Month. And we're going to talk about glaucoma. Our guest speaker is going to share what it is and who's at risk and some other details and facts about glaucoma and the importance of having an annual eye exam. So if you haven't had your eye exam this year, don't delay. Get it scheduled today. Contact your local optometrist and be sure to get on their schedule for your eye exam. The National Optometric Foundation I am the treasurer for the National Optometric Foundation, and we are the financial arm of the National Optometric Association, our parent organization. And we support them in various ways with community activities. We're doing community events together, usually at the National Optometric Association convention each year. We are serving those in the community with free eye exams and free glasses. We also support the National Optometric Student Association in various ways, trying to help them get to our convention, supporting them financially with scholarships. Thankful to our sponsors and our donors for allowing us to be able to generously give scholarships to our students. And we support students who are thinking about going to optometry school while they're in high school and while they're in college. We're talking to them and encouraging them to consider optometry as their career choice. So we want you to continue to support the National Optometric Foundation and allow us to be able to do these great things for students, for our community, for other optometrists. And you can do that in various ways there. First, I want to invite you to go to our website and connect with us on the nationaloptometricfoundation.com. You can join and be a part of our community there. You can join our Facebook page. We do have a Facebook page, National Optometric Foundation, and we also have a Cash App. If you want to donate tonight, we encourage you to do so on our Cash App as well. Protecting the Vision, $ Protecting the Vision, where you can donate and help us continue to do these great things there. So subscribe to our YouTube channel. We're there. You can go and subscribe to our YouTube channel, National Optometric Foundation, our Facebook page, and our website there. So we want to go ahead and introduce our special guest for tonight, Dr. Cynthia Hurd. She is a native of Jackson, Mississippi, and graduated in 1987 with her Bachelor of Science degree from Jackson State University. Yes, she did. She also graduated in 1992 from the Ohio State University College of Optometry, and she completed a residency in vision rehabilitation and geriatric vision at the Birmingham Veterans Administration Medical Center, affiliated with the University of Alabama School of Optometry in 1993. She joined the clinical faculty at the Ohio State University College of Optometry until 2007, after which she joined the faculty at the Southern College of Optometry, and now Professor Dr. Hurd's professional areas of interest include nutrition and eye health, ocular disease management, and care for individuals with low vision. She is also committed to recruitment and retention of individuals of color to the profession of optometry. Dr. Hurd is a member of the American Optometric Association, the AOA, the National Optometric Association, the NOA, Tennessee Association of Optometric Physicians, West Tennessee Optometric Physicians Society, Fellow of the American Academy of Optometry, and Tennessee Academy of Optometry, and she is a past president of our National Optometric Association. Wow, this lady has done a lot. Welcome to the show, Dr. Hurd. We are so glad to have you on the show. Thank you so much for being a part and share with the community tonight. How are you feeling?
I am great. Thank you, Dr. Brown, for inviting me here.
Absolutely. And I was talking earlier about this being a day of service. And since we talked about it briefly, I just wanted you to share, how was your day today during this day of service, recognizing and remembering Dr. Martin Luther King?
My husband and I actually volunteered for an organization called MIFA, and they do Meals on Wheels. They recruited 110 drivers to actually pass out 1,000 meals to seniors throughout the city.
All of that happened today.
All that happened today.
Wow.
Probably within a 2 to 3 hour window.
Wow. Incredible. 1,000 seniors impacted today because of 110 volunteering drivers doing this initiative here. Wow. That's incredible. And see, that's where it goes back to that quote where I said, anybody can be great because anybody can serve you. And you guys did a fantastic job there with that organization today. And we applaud you for that. And thank you for your service today in your community. Thank you so much. We were open today at the office, serving our community, giving eye exams to adults and children. And it turned out to be a great day of service, making sure that we are saving eyeballs one eye at a time. So we enjoyed our day as well. And we're looking forward. I've been talking about it all day. I was like, Dr. Hurd is going to be on our webinar, our first webinar for 2023. And here you are. So I will go ahead and let you get started with telling the audience a little bit about glaucoma. You know, glaucoma, I'll just say this briefly, is one of the initiatives that the National Optometric Association always try to educate the public about. Because it's one of the 3 silent killers of vision there. So I want you guys to tune in tonight as she dive into glaucoma a little bit deeper and share with you all about it. Okay, Dr. Hurd, you can have the show.
Thank you. Thank you. I really appreciate the invitation again. One thing I do want to say about the 3 Silent Killers program for through the National Optometric Association and through the foundation is that there was actually a small group of us in the very beginning in 2003, if I'm remembering correctly, who actually created the verbiage for the Silent Killers program. And then we worked with the administrative manager, Dr. Comer, who is now passed on. And he made this information available to our members so that members could actually talk to patients about things that could affect their vision that they may not be aware of, such as glaucoma, high blood pressure, and diabetes. So these were some things that I was involved in very early in the makings of this program. Now we're going to go ahead and get started with our presentation here. So what I want to do is, first of all, look at glaucoma from a glance, because I want you to be aware of some of the things that you may not know about, but you just need to be aware of things like the fact that glaucoma doesn't have any early symptoms in most situations. So this is something that is really troubling, simply because most people don't know when the issue is coming about. That's why you have to be aware of what's going on with your vision, and you have to have your eyes checked routinely. That was one thing that Dr. Brown brought up a little bit earlier. Now, later in the disease, the individual could start to experience loss of their side or peripheral vision, or they may feel like people are all of a sudden popping up on their side, or even an object or a vehicle. So that can be very dangerous, and that's something that unfortunately happens somewhat later in the disease, and that area of vision unfortunately cannot be restored. So so that's why it's so important to have it diagnosed early. Now, in the diagnostic process, the main thing that we do as eye care professionals is we dilate the pupils, and we look at the optic nerve, as well as running visual field technology, looking at the visual field. And we have lots of other technology that we also use to look at the measurements or look at the thicknesses of the different parts of the tissue on the back of the eye and the front of the eye. And all those things together really helps us to figure out, if glaucoma is present or not present. Then, as far as treatment goes, the thing to know here is treatment can be in a few different forms. So you can be treated medically, usually in the form of eye drops, but there can be systemic medications taken by mouth as well. So it just depends on what the condition is. Laser procedures are being used, as well as conventional surgery, where you go into the operating room and they actually have to at least partially sedate you so that they can do the surgical procedure um, in order to get the job done as far as management for glaucoma. Next slide, please. Now, in here, I just want to show you kind of a pictorial way of looking at glaucoma at a glance. And then the comments on each portion here is just telling you something a little bit different. Again, glaucoma is a condition where basically the pressure is too high inside the eye in order to keep the optic nerve healthy. So you'll see in that middle diagram there, where it says glaucoma, what is it? It's basically showing that the individual has no symptoms, especially in the early stages of the disease. Now, what are the numbers? So it is estimated that about 2.7 million individuals in the US have glaucoma, but half of them don't know it. So that's where you have the black figures who know, and then the red figures who don't know. And you can see there are just as many red figures. Again, that's because people have no symptoms whatsoever. And if they're not having their eyes checked, then they have no idea that glaucoma is present. Then, when we look at glaucoma down the line in the future, so in 2030, it is estimated that glaucoma will be about 4.2 million individuals in the US with this condition. Other things that you need to be aware of is that African Americans are more at risk for developing glaucoma above the age of 40, so they tend to be younger. Everyone else, the age of 60 is where glaucoma can become more problematic, especially with Mexican Americans and other Latinos. Family history can be a part of the glaucoma picture. So you need to know what's going on as far as your family members go. And I talk to patients about this all the time. I tell them to please ask other members of their families, even if they're visiting for holidays, if they have been told that they have glaucoma, or even if they're at risk for it, like are they a glaucoma suspect? I said, I realize this is something that you don't necessarily talk to your family members about because it just doesn't come up. But this is important because your eyes are showing signs that are putting you at risk. And we need to know if you have family members that are also at risk. And I think people really appreciate knowing that. Now, the important thing to making sure that glaucoma doesn't develop and then take over to the point where the vision can't be restored, that's where the comprehensive dilated eye exams come in. So I usually recommend, depending on my patient's ages and depending on what medical conditions they have in general, I usually recommend they have their eyes checked every 1 to 2 years, um, and make sure that they do have their eyes dilated, because sometimes patients do ask not to be dilated, but I make sure and explain to them that they need to return for that dilated portion, especially if they would prefer to have someone drive them when they're dilated. And I understand that. So we just try and make sure that those things are covered and that we get them rescheduled before they leave that day. That's another key part. And then there's lots of information online. The National Eye Institute, along with the National Institutes of Health, have really good information on their website. And we'll talk a little bit more about some of the resources as we get a little further along. Next slide, please. So let's talk a little bit about the types of glaucoma. This is a very short list. I have to tell you that from the very start. So when we're talking about types of glaucoma, the most common types that we see or manage in the United States is typically open angle glaucoma, along with normal tension glaucoma. Now, individuals who may be at a little bit more risk for the normal tension glaucoma, meaning that their pressures are usually normal. So their pressures are usually below 21. We're looking for numbers that are between 10 and 22. And that is millimeters of mercury, kind of like the pressure in a basketball, so to speak. So we're looking for pressure numbers like that. So some people can have glaucoma and have pressures of 15 or pressures of 20. So that's something that we also have to explain to patients when we are talking to them about the whole pressure aspect of managing their condition. So about 90% of individuals have the open angle variety in the United States. Sorry, I didn't include that. Now, acute angle closure glaucoma, that is a condition where the eye typically is smaller than normal, especially in the front part of the eye. And I'll show you a diagram of a couple of eyes in a moment that just kind of give you an idea. When the structures are compact together, that can cause the pressure to go up. And I'll show you the drainage angle and how that can happen if the structures are too close to each other. So this tends to occur more so in individuals of Asian descent all over the world, as well as Alaska Natives. So not so much here in the United States per se, but we do see our share of angle closure. Then we have congenital glaucoma. So babies can actually be born with glaucoma for various reasons. And as a result of that, that condition needs to be found and that child needs to be managed. But you can see here in the occurrences, only one in about 10,000 to 18,000 live births will experience glaucoma. So it's not very common, but it requires surgical intervention when it does happen. And when it comes to this particular condition, typically the physicians kind of know what congenital glaucoma looks like, and they tend to get those babies in to see the right individuals so that they can lower that pressure. Because if their pressure doesn't go down right away, they could end up being essentially blind from the very start. But But they also, unfortunately, because of the nature of the condition, they do tend to end up losing vision as a result of being born with glaucoma, because it can be harder to manage. These individuals have abnormalities in the structures where the fluid drains out of the eye, and sometimes it can be hard to manage exactly how to get that pressure to stay in a particular range or to stay lower so that their eye can stay safe. Next slide, please. Now let's look at some of the symptoms and some of the risks that are associated with glaucoma. Now, some of the symptoms, you can see the very top one is basically no symptoms, especially for open angle glaucoma. The eye doesn't hurt. In fact, the vision just slowly goes away, and it's a painless loss of vision. So this is something that can be very crippling to an individual, especially if it gets into the advanced stage. So there, and the condition tends to produce a very slow loss of the side vision. So the part of the vision that people pay attention to the most is our central part, where we read things, we drive, we look at things like our watch, or we look at the time on our cell phones. We don't pay attention to our side vision so much, but we definitely know when we don't have it any longer, because we can't look off to our sides and really see all the detail that we need to see. We can't see things again, we can't see things off to the side, especially once the vision loss becomes more like a tunnel. If you look at the diagrams on the upper right-hand side of this slide, you'll see here in healthy eyes, the individual can see the entire landscape as they're driving or as they're riding in a car. And you can see that they have good side or peripheral vision. Now, individuals, when they develop glaucoma, it doesn't go dark like that. It just goes missing. So this is just a diagram to show you which part of the vision is missing. And you can see there are large areas on the sides that are missing, where the individual, again, if something pops up from the side, they have no idea it was there. And what if it was very close to them when they did finally notice it? If they bump into someone, or if they're in a car driving and they bump into another car, or heaven forbid, a pedestrian, that could be a really serious situation. Now let's look at the risk factors. Sorry. The last thing I want to mention about the symptoms is eventually the vision will become blurred everywhere. So seeing your watch, seeing your cell phone, things like that do become difficult eventually, because glaucoma will take away all of the vision if it's not treated. And unfortunately, this is an irreversible type of loss. So if the vision is not treated or managed, or if the glaucoma is not managed to the level where the vision can remain stable, or the visual field can remain stable, then the vision loss is permanent. And unfortunately, that's a really difficult and tough conversation to have with the patient and their family member. Now let's talk a little bit about the risks. So again, individuals over the age of 60, mostly as far as different groups of individuals in the demographic. That's the number that we target as far as educating patients to make sure that they know that they're at higher risk for glaucoma, because they're of the age of 60 and higher. Again, African Americans and Latinos, there actually have been studies to show that Latinos can get glaucoma at younger ages as well. So that's another thing that I also talk to those patients about if they're sitting in my chair. Medical conditions that they may have, such as high blood pressure or diabetes, can really be a major risk factor for those patients. And I make sure that they understand those connections so that they hopefully aren't ignoring especially managing those conditions as well as managing um, their eye conditions, such as going to the doctor every year to make sure that everything is stable or make sure nothing is showing up as far as disease goes. Family history is a big one for glaucoma. And this is where I tell those patients of mine to talk to their relatives, especially their siblings, to ask about disease. So when I say close relatives, I'm talking about mom, dad, brother, sister. So those are the biggest connections that tend to put people at risk for glaucoma. Not so much with grandmother or an aunt or a nephew or whatever. Not to say that those can't be risk factors, but it's the closeness of the relative that makes the difference. An injury to the eye. That's another thing that I don't think people pay attention to very much at all. But if they have a major injury to their eye, especially if they had to get treated for it, where they ended up in a doctor's office or maybe even in an emergency department and had to get that eye treated because of an injury. Glaucoma doesn't necessarily show up right away, but it can show up 20 years later, 30 years later, 40 years later. And they will have forgotten about that injury by that time. But you have to be persistent when, and at least I am, when I'm talking to those patients, and I ask them to tell me um, if they can remember having some sort of injury. And many times they'll tell me an interesting or funny story about getting into a bar fight when they were in the army or something like that. So it's pretty interesting when you talk to these patients and give them time to answer those questions for you, because then it ends up being a pretty interesting exam. Next slide, please. Now, let's talk a little bit about diagnosis and treatment. As far as being eye care professionals, optometrists are very good at diagnosing glaucoma and treating it. This is something that we're trained very well to do, even as optometry students and residents when we're in the middle of our training. So, as far as diagnosing glaucoma, we use tests to screen for glaucoma, and if those tests have either um, either positive um, effects, or if they have certain effects that we would consider a risk factor, um, then we kind of put that together along with other things. Glaucoma is really a big puzzle that we have to fit the pieces together, and then we have to decide if we think glaucoma is present or not present, unless the person has vision loss already. The majority of time, we absolutely know they have glaucoma if they have vision loss, especially visual field loss. And the main thing to do is to get them treated, um, and to make sure that they understand the importance of using the drug and coming back for future management and those sorts of things. So when we're looking at tests for screening for glaucoma, we check the eye pressure every single time the individual comes in to our office. We also check visual fields because we need to know what the side vision is. Now, we also have other instrumentation that I mentioned to you a little bit ago, other than dilating the eye and looking at the optic nerve very carefully, but we can take certain measurements from the optic nerve and the tissue around it to see if it's thinner than normal. If it's thinner, that could be a risk factor for glaucoma. We also look at the thickness of the front of the eye, believe it or not, because that could kind of indirectly infer that glaucoma could be on the horizon if that area on the front of the eye is thinner than normal. And we have population normal averages for all of those things. So we know abnormal or thinner than normal when we see it. And then sometimes it can be thicker than normal, which actually is a bonus. That means that the person probably won't develop glaucoma. So we have many different conversations with patients as we go through the information as we're gathering it as well as we're talking to them about their family history, their medical conditions, and other things that might come about. Now, so the treatments, we're going to talk a little bit more about those again. Medicine in the form of eye drops is by far the most common treatment that you're going to see or that you're going to have, especially early on in the disease process. And as long as the person uses the eye drops um, to the degree that they are instructed to use them, they come back for their visits, we check their pressure, then everything tends to stay pretty stable. So there's no magic to it. There just is consistency that needs to happen. Um, then there are laser procedures. Now, a lot of the laser procedures are basically considered microsurgeries now. So you don't really have to go into an OR for microsurgery. A lot of the appliances that are placed in the eye or in the front of the anterior chamber area, they're so small that all you have to do is use an applicator to input them, and they basically do the work. So that's been a really nice update in surgical procedures when it comes to managing glaucoma, especially in the last 10 or so years. That wasn't the case when I graduated from optometry school. Then the conventional surgeries are ones that are still being done. They tend to be a little bit more invasive. It does tend to involve actually um, uh, doing incisions to the eye with instruments, with the scalpels and things like that. So those folks end up going to the OR. They usually are sedated. So that, excuse me, so that the surgeon can do his or her job in order to make that procedure as successful as possible. Next slide, please. Now here, I just wanted to show you a couple of images so that you get an idea of the area of the eye that we're talking about. So on the image on the left-hand side, you can see that there's actually a beam of light that is shining from the top to the bottom of the cornea. The cornea is the clear part on the front of your eye that we basically look through. It's like a pane of glass. We can see the iris, which is the colored part, and we can see the pupil, which is basically an opening inside of the iris area. So when the beam is moving across the eye like that, we actually can look to see if how close the structures are to each other. So when you look at the beams here, we look at where the beam hits the cornea, and we look at where the beam hits the iris. If those two structures are really close to each other, then that means that particular anterior chamber is shallow, and that person is at risk for angle closure. So that's a very dangerous situation if it happens. Then when you look at the diagram over here on the right, it kind of shows you, if you look in the circle there, it shows you the structure that's sitting. It's in the front part of the eye, but it's a little further back than where the anterior chamber angle is. So that area is called the posterior chamber, and that's where the fluid in the eye is produced. So that fluid goes from the posterior chamber, it goes around the lens. The lens is the structure in the eye that can actually develop a glaucoma. Develop cataract eventually, if the individual is old enough to have cataracts. Um, but that's a side conversation in regards to this. So the fluid is produced in the posterior chamber. It goes around the iris and the lens, goes through the pupil, and then drains out of the area called the trabecular meshwork, or the drainage angle. So the drainage angle is kind of like a sink. So if you stop up the sink with a plug, which eventually aging is what can tend to cause that to happen with individuals who develop glaucoma. The drain just doesn't drain the fluid out sufficiently. If the fluid in the posterior chamber is being produced faster than the fluid is actually draining out of the eye, that's when the pressure starts to go up. And when that happens, then fluid will tend to translate to the back of the eye and damage the optic nerve. So it's a pretty complex process, but we have an idea as to why glaucoma develops and why it has a tendency to damage the optic nerve. Um, if we can get that pressure lower, then it won't have a tendency to do that to the optic nerve, and the individual can maintain relatively good vision for the rest of his or her life. Next slide, please. Now, things to know when it comes to treatment. It's really important to understand that once you are treated for glaucoma, that treatment needs to happen from here to eternity, is basically what I tell my patients. So, one thing about glaucoma is that you can't necessarily treat it for a little while and then you're cured, because the treatment doesn't cure glaucoma. All the treatment does is prevent vision loss and prevent visual field loss because the optic nerve is not being damaged nearly as quickly. That doesn't mean the optic nerve isn't being damaged even when treatment is implemented. It's kind of a balance. You have to figure out, okay, how much can I lower the pressure so that the optic nerve doesn't experience any further damage, and so that the visual field will stay exactly where it was when we first started to treat the eye. So that's what it really boils down to. So when it comes to treatment, you have to use it every day. Use it on the schedule that the doctor recommends. Now, if for some reason uh, you're having a hard time keeping that schedule, you need to talk to your doctor about it. Because I had a patient just last week who wasn't putting drops in her eyes because we told her to put them in at bedtime. And she said she would just fall asleep. And unfortunately, about half to about one third of the time, she wasn't getting those drops in before she went to sleep. So I basically decided to change the time frame in which she uses the drop. I said, well, can you put it in the morning? And we put it in at the end of the day for a certain reason. And I'll tell you about that later. But actually, I'll tell you about that soon, because of one of the side effects of one of the drops. It can have a tendency to cause the eyes to turn red, and people don't like the way that look. So, it was decided to have the person use these drops at the end of the night at bedtime, and then by the morning, their eye isn't as red as it was as when they first put the drop in. Now, eventually, the body does equilibrate, and the eye stops being so red after the person's been on the drop for 2, 3, 4 months. So it's not as much of an issue later on, especially as the body adapts to it. Now, some of the other side effects that people really don't like is that it can sting and burn. And sometimes people have a hard time just getting the drop in their eye. Sometimes they're wasting drops on their cheek or on the bridge of their nose, and that can be a really major issue, because these drops are not cheap, and they need to be able to use the drops effectively, so that they are not wasting their drops by wasting it in other places beside their face or beside their eye. Other things that the drops can do is they can blur the vision temporarily. That's usually not a big issue, but that's something that we warn patients about. Other things, it can change the eye color. There's a certain class of drops that can do that. It can change the eye color um, from hazel or green to a brown, or from a lighter brown to a darker brown. Um, and we don't necessarily know exactly why that happens, but it doesn't tend to have an ill effect on the health of the eye, although the color of the eye changes. It can grow the lashes longer, which some people are okay with that, especially people who want to have longer lashes naturally. It can tend to induce headaches, but everything that, if you looked at all the patient information leaflets for every drug, I think headache is on every list. So that's not an unusual thing. It can change your energy level, especially if you're using something that's like a beta blocker. Beta blockers are used a lot for managing high blood pressure. They're also used to manage glaucoma because they tend to lower the pressure inside the eye too. And so that's something that has to be made note of. And some people will sometimes complain of dry mouth or even a metallic taste in their mouth. It really depends on the individual. So those are things you have to talk to your doctor about. If it's an undesirable side effect, then we have to figure out another option in order to get you to continue to comply with having your pressure lowered. That's just the nature of it. Next slide, please. Now, some of the resources, what I want to do here is just give you the names of some of the things, especially online, that you can go to, like the National Eye Institute, the National Eye Health Education Program, which is the program that the NOF and the NOA pairs with or has paired with for many years to get information out to individuals so that they can understand that even systemic conditions that they have can affect their eyes or their vision. The National Optometric Association Three Silent Killers program, which is through the NOA and the NOF, the American Optometric Association, the American Academy of Ophthalmology. So those are individuals who are surgeons, but they also address issues with glaucoma that complement what optometry does. And in some cases, we duplicate services. They also prescribe drops for patients or systemic meds if they need it, which both of us can do those things. Glaucoma Research Foundation. Um, Pretty much all the sites or the organizations I've listed here have social media pages, and you can go there and you can either like or follow them so that you can continue to see information on their social media um, outlets. And then there's videos and webinars, especially YouTube and even some videos on Vimeo. So those are things that you can definitely go to. And one thing I just wanted to put on this particular slide is just showing you one of the visuals that NEHEP, or the National Eye Health Education Program, has information such as the diagram on the upper right hand side here. It says, don't wait for warning signs. Basically, you need to have routine dilated eye exams to see if glaucoma is going to happen. Next slide, please. Now, in summary, um, the thing to be aware of is glaucoma in the early stages basically doesn't have any symptoms or any signs. So you have to see your eye doctor in order to know if glaucoma is potentially coming or if you have it already and just aren't aware of it. Glaucoma doesn't tend to cause the eye to hurt, which people tend to think that, and it doesn't make the eye red. So so the eye can be just as happy as a clam, but the pressure can be too high and the optic nerve can suffer damage, which is what causes the visual field to leave. Routine dilated eye exams are needed not only to look for glaucoma, but also to look for changes from diabetes and high blood pressure, because those are some very serious conditions that can lead to permanent vision loss, and that doesn't have to happen. Glaucoma actually can be managed very, very well as long as you're using the drops or the surgeries or whatever it is your doctor happens to recommend to you, and you never have to lose any meaningful vision. I talk about this all day with patients. And then once the vision is lost, unfortunately, it cannot be restored. So vision loss is permanent. And that is something that I stress, and stress again. because it is something that people really need to hear, and they need to hear that they have to maintain treatment for the rest of their life. This is going to go with them to the very end. Next slide, please. Thank you. I just wanted to know if there were any questions. And I guess you can go ahead and put up my slide that has my contact information on it, if you'd like to.
Hey, Dr. Hurd, yes, you have unpacked a lot of great information for our audience tonight. Thank you so much. I mean, you know we're taking bits and pieces on this topic of glaucoma because, as you said, it can expand to so much more when it comes to talking about glaucoma. And one of the things that I think that you pointed out is that people need to go in and get their eyes examined 1 to 2 times every 1 to 2 years. Go in for your eye exams because of those not having any symptoms early on, when it comes to glaucoma. And we don't want it to be where it starts out with your peripheral vision loss and then soon it comes in more loss. We want to catch these things early on, as she mentioned, so that it can be managed, it can be treated there as well, diagnosed, by an optometrist there, so that the help is given to you sooner versus later. I think one of the questions before I do anything else came from our audience was talking about not only people who are not diabetic, or he said diabetic, can develop cataracts, from being a diabetic, also from having glaucoma. And he just wanted you to just revisit that topic again and talk about the risk of them developing that cataract, because I think that caught their attention when you mentioned that during your presentation.
Okay.
And how that can make the condition worse, when it comes to glaucoma.
Gotcha. When as people get older, when they develop cataracts, what happens in that situation is the lens inside the eye, it starts out really thin, but as we get older, that lens becomes thicker and thicker. It's like adding layers to an onion. And so the structures in the front of the eye can become more and more crowded. I've actually had 2 patients in the last week that I referred out for cataract surgery to manage their pressure, because this is really a big deal. Because if we can get rid of that cataract, put in a really small implant, then the area in the front of the eye becomes debulked, so to speak. So you have a lot more room there, and the pressure will naturally go down. So that's one thing that I'm starting to realize, that we need to take advantage of that particular technology more. Was there anything else to the question that
No,
maybe
I
we
think
didn't
that
address?
question there. Thank you, Mr. Larry Hunter there in Augusta, Georgia. He reached out with that question. Just wanted you to just talk about that some more. And thanks to those who have made comments, about taking care of your eyes. It's very important that you take care of your eyesight. There is very valuable, and look at all the beauty around us that we have there. And I know people who have lost their vision, they have regrets, and like you said, those conversations are hard to have sometimes with patients when it comes to the different stages of glaucoma and the possible outcomes, when you look at the visual fields and we do the screening test there, so we want you guys to come in so that we can screen for glaucoma, so that we can check your pressures there, so that we could do these visual field tests as well and examine the optic nerve, as she mentioned, so that we can help preserve vision. That's the whole point of us doing these webinars on a monthly basis there, so that the community is educated and about the importance of coming in. Come in and see. An optometrist is one of the friendliest doctors you're going to meet. Look at Dr. Hurd. Doesn't she look friendly? It's one of the friendliest doctors you're going to meet, and they're going to have your health, to their heart. They want what's best for you, what's best for your family. One of the things I wanted to just talk about that I thought was important that you mentioned is having the conversation. Too often, when we get together with family, we talk about sports and we talk about, school, but we don't always talk about our history and our health. And that's very important to have that conversation so that we can see who else in the family may be at risk when it comes to glaucoma. So we want to encourage you guys as you get together with your family here in 2023, or maybe you could call someone up if you don't live close by. Talk about your family history there and make sure that it's not a secret. You should talk about these things because your eyesight depends on it. As Dr. Hurd just shared with us there. I'm going to check to see if we had another question that popped up. I saw coming in here from the audience there. Didn't want to miss out on anybody. You guys continue to share your questions and we'll try to get to them. Lisa Bennett was saying, thank you, Dr. Hurd, for the great presentation. She'd like to share the link for this on her social media page. Absolutely. It'll be a link off of our YouTube channel that you can share, Lisa, and you can continue to help us educate communities there. And also, Dr. Joseph McCray was saying, great information presented, and you did it in terminology that everyone could understand. And that's important too. You mentioned educating patients. And when doctors are in the examination room, talking to patients, educating them about their findings, it's important that they have that one-on-one conversation where the patient understands. And so my question to you, Dr. Hurd, is what advice will you have for someone who's a caregiver or a driver or a family member that may be bringing their patient to these examinations? And it could be an older parent, it could be an aunt or uncle that they're bringing. What tips could you give them, or what's important? Because I know you've seen a lot of people accompany patients to their examinations. How can they be of support and assistance to that family member at the examination, and maybe if they are a caregiver, helping them with their medications as well?
For sure, especially older patients, they have dexterity issues. They can't hold that tiny bottle sometimes and squeeze the drop out, or they'll squeeze it and it'll hit another part of their face. So I usually recommend that the patient ask someone to assist them with getting those drops in their eyes. And that helps them tremendously. That actually improves compliance significantly. And I also educate those individuals that they need to be getting their eyes checked too.
Right. It's
That's really
absolutely.
important.
That's key. That's key. Letting them know, especially if it's a family member that's accompanied them. We know that glaucoma is something that if you find it in one family member, you're always asking to see if the rest of the family is informed about this finding as
Yeah.
well, so that they can get checked. So that's right on point, Doc, for what you should be doing. And it's important that we help them find ways to not waste those drops because, as you mentioned, they're not cheap. Those drops cost money, and we want to make sure that the patient is getting the treatment. Too often, patients keep these things away, and I'm talking to you all who may be listening. Let the doctor know if you're not taking the medication as prescribed, because the doctor, when they examine you and they look at the results and they look at their findings, their next step for management and treatment depends on those findings. So if those findings are off and they're thinking that you're taking the medication, they may want to add on another one. So just be honest and let the doctor know if you're missing some days where you're not taking the medication, if you are not taking it because of some of the side effects that Dr. Hurd mentioned. Those are things in cases that we've had in clinic as well. And we want you to know that we're here for you. And we want that conversation to be open so that we can find out if there are any challenges that you're having, so that we can make adjustments and give you the best treatment possible there as well. We want to help preserve vision. And during this month of Glaucoma Awareness, the National Optometric Foundation and National Optometric Association We want to educate our community, and we want you to connect with us. As you see, we have a website, nationaloptometricfoundation.com, that you can join and follow us. And you can go on our YouTube channel, where you'll be able to see some of our webinars from the past that we did in 2022. This webinar that we're doing today with Dr. Hurd presenting a great layout for glaucoma and here in 2023. You can share this with your family and friends. Just get the link off of our YouTube page, National Optometric Foundation, and share it. And continue to support the National Optometric Foundation through giving. If you want to give tonight, our Cash App is open at $ protecting the vision. And you can send us a $5, $10 donation, whatever you may have. It allows us to be able to support these young minds that's currently in optometry school, studying to become an optometrist. Those who are thinking about becoming optometrists, we try to support and give them transportation to our National Optometric Association conventions as well there. So you unpacked a lot of information. I think that it's important that we continue to drive the point about getting your eyes checked on a yearly basis there. Even if you don't have any what you consider to be problems, you should go in to see your optometrist, get on their schedule. Don't delay, do it today, and make sure that you get a dilated eye exam on a yearly or every 2 years, making sure that it's checked. We don't want these things to sneak up on you. It could be the sneak thief of your vision there. And glaucoma, along with diabetic retinopathy and hypertensive retinopathy, those are the 3 silent killers of your vision. And we want you to be informed tonight. We want you to be informed every time we do one of these webinars here. So in closing, Dr. Hurd, if you have anything additional that you would like to point out to our listening audience, let them know how they can follow you or be in touch with you, or for your local community, you can go ahead and present that at this time.
What you can see here, if you would like any information from me that I presented tonight, you can reach me by email or at my office phone. I'm at Southern College of Optometry in Memphis, Tennessee. Thank you.
Absolutely. Thank you so much for being on the show. It is a pleasure to have you on our first show for 2023. And I look forward to possibly bringing you back later on in 2023 on a different topic to share with our listening audience as well there. So thank you, Dr. Hurd. I'm going to go ahead and close out the show. Thank you to our great audience for tuning in tonight and listening as we unwrap some great information about glaucoma during January, Glaucoma Awareness Month. The National Optometric Foundation is a nonprofit organization. Dr. Andre Whitehead is our president. The National Optometric Association, Dr. Larry Jones is the president of the NOA, and we thank you all for your support. We thank our donors, we thank our sponsors for allowing us the opportunity to be able to help various communities in different ways. And we want to continue to service our communities. And service is very important, especially on this great day that we remember the Reverend Dr. Martin Luther King Jr., a day of service. So we all can do great things because we can all serve. So don't forget that. Continue to support us, continue to follow us. We'll be on Facebook, National Optometric Foundation. We'll be on our YouTube channel. We'll also have our website updated regular for you guys to find out more about us. And if you would like to find out how you could become a part of being a friend of our board, we'll be glad to have you as one of the friends of the National Optometric Foundation board as well. So thank you guys. I hope you have a great evening. And thanks again to Dr. Cynthia Hurd for a great presentation on glaucoma. And we'll see you guys next month in February as we celebrate Black History Month. And we'll have a guest speaker speaking with us on a different topic then. Have a great night, everyone.